It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So we get a lot of emails all the time from readers who really tell us what they think about what's going on with their loved one in ICU. And we had an email from Tom who says, the ICU where my dad is currently in doesn't provide advanced treatments. They only give you the constant negative news. What should I do? And this is, one of the challenges that we are hearing all the time, over and over again, that ICUs are so negative and that families are getting sick of hearing it, and that is actually one of their biggest challenge. And I can understand that, having worked in intensive care for over 20 years in 3 different countries, where I have worked for over 5 years as a nurse unit manager. And now I have been consulting and advocating for families in intensive care for over 10 years, for families in intensive care all around the world, as a matter of fact. So let's dive right into it, what you should be doing when you are constantly faced with negative news for your loved one in intensive care, and when you think they don't provide the advanced treatment that your loved one can get. Well, first off, you must have done some research, which is great. 99% of families in intensive care, they're not even doing their research. So, give yourself a pat on the back for doing your research and for, standing up for what you think should be happening and asking questions, because that's the first step to improve the situation. Now, how should you deal with negativity, and how should you deal with, when they're not offering the treatment is available? First off, you need a second opinion to verify your research, right? And we can give you a second opinion here at intensivecarehotline.com, right? So we see this all the time when we work with clients one-on-one, and we either talk to doctors and nurses directly in ICU, or we look at medical records, that intensive care teams are not even telling you half of the story of what's going on, and they're constantly focusing on the negative rather than focusing on the upside, rather than focusing on, okay, well, what can we do here rather than what can't we do? Okay, big distinction. You can focus on the negative or you can focus on the positive. And I strongly recommend you focus on the positive and not on the negative. Now, so why do ICUs do that? Well, they have a glass half full mentality, a half empty mentality rather than a glass half full mentality. And you need to counteract it. And why do they do it? Well, there's high demand on ICU beds, i.e., the worst case scenario for an ICU is to look after someone indefinitely with an uncertain outcome. And many ICU patients fit that criteria, unfortunately, because of their condition. So uncertain outcomes. So it's much easier to deal or to focus on the negatives and quote unquote pull out, no longer offering any treatment and withdrawing treatment and all the rest of it, and no longer having to deal with a family that asks all these difficult questions, especially if you come to our website where we educate families of critically ill patients in intensive care, and we give them all the tools, to start asking the right questions. So again, Tom, give yourself a pat on your back for doing the research and asking the right questions. So the next step here for you, Tom, is, we can do a medical record review, or we can also, do a medical record review, but I'm also happy to talk to doctors and nurses directly. And I will ask all the questions that you haven't even considered asking, but you must ask so that you make informed decisions, have peace of mind, control, power, and influence. And you will see that once I'm starting at either questions, or once we look at the medical records and give you all the details, that you need to know, that the dynamics will actually change in your favor. Then the intensive care team knows you have someone on your team that understands intensive care inside out just as much as they do. And that's the only way to counterbalance, their perceived power. But keep in mind, it's only perceived power. You have power too, by standing up for what you believe in, by, asking all the right questions. And ICUs have to follow your lead. They can't just pull out on treatment. That could be could get them into legal trouble, you know, if they won't continue treating your critically ill loved one, you know, if they were going to die and you have not approved withdrawing treatment or limiting treatment, then, you know, that could be perceived as euthanasia, it could be perceived as murder, you know, you have to consider all of that, and you might have to consider all your legal actions in a situation like that too. So that is my quick tip for today. Now, we have a membership for families of critically ill patients in intensive care at intensivecarehotline.com. If you click on the membership link, or if you go to intensivecaresupport.org directly. Now, in the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. I also offer one-on-one consulting and advocacy for families of critically ill patients in intensive care. I talk to you directly, I talk to your family members directly, I talk to doctors and nurses directly, or to case managers, and I ask all the questions you haven't even considered asking, but must be asked, so that you make informed decisions, have peace of mind, control, power, and influence. I also represent you in family meetings with intensive care teams, and I establish whether you should actually go to a family meeting or not, or whether there's other strategies you should be pursuing first, because going into a family meeting without a strategy, it's doomed to fail for you, and intensive care teams will have the upper hand if you go in there unprepared without advocacy. I can assure you of that. I've been in those meetings, you know, hundreds of times, either as a bedside nurse or now as a professional consultant and advocate for families in intensive care. Now, we also offer medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. Thank you so much for watching. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell. Comment below what you want to see next, what questions and insights you have, and share the video with your friends and families. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.